How do you keep a baby or toddler with food allergies safe, especially when they can't talk and they put everything in their mouths? This is the third episode in our Food Allergy Ages and Stages series, inspired by the American Academy of Allergy, Asthma, and Immunology's Ages and Stages handouts. Today, we're talking about how food allergy care changes from baby to preschool, what symptoms to watch for, and how to build safe habits from the very start. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank Genentech and Aquestive for sponsoring today's episode. While they support the show, all opinions are our own and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's get into it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today, we have another amazing friend on the podcast, Dr. Basil Kahwash, and I'm super excited to be talking about this topic with you, Basil. Do you mind introducing yourself for our audience?
Sure. My name is Basil Kahwash. I'm a board certified allergist and immunologist here in Columbus, Ohio, in a group called Ohio ENT and Allergy Physicians. And I have been a practicing allergist immunologist for going on 5 years now. And I've known Dr. Gupta for several years and recently just met Kortney. It's an honor to be on the show.
We are very excited to have you on with us today, talking about how do you manage food allergies when you've got a 0 to 5-year-old. So I guess the big question is, why are we breaking this down into specific age groups?
Yeah, because kids grow up fast. So the age recommendations that you have for a kid really vary depending on what stage of development that kid is in. And that tends to correlate pretty well with how old they are. Of course, some kids are going to be a little bit advanced for their age. Some kids are going to be a little bit less mature for their age, just like a lot of adults are, right? Obviously. But kids grow up fast. Their behavior changes even faster. Babies can be totally dependent on their caregivers, their mom especially. A toddler might be wandering around imitating what adults are doing or what other people in their lives are doing, older siblings. A preschooler is going to want to establish some independence. And then, of course, when we talk about older children like adolescents, teenagers especially, then I know that's not the focus of today's episode, but obviously their needs are different than what the younger kids' needs are. So our allergy safety approach has to grow up right alongside the developing and the growing up child.
Great. I mean, that makes a lot of sense. So can we talk about 0 to 1 and how do they get exposed to food allergens?
Yeah. So, what we want to remember with the 0 to 1 year olds, as Basil mentioned, is that they are a totally different age group and everything is hand to mouth. They learn everything through their mouth. And so that's when it becomes really scary as a parent with an infant with food allergies, because you're always worried about what they're putting in their mouth. And so that's one of the key things that we need to think about and worry about with this infant age group. As they get older, that habit slowly subsides and we don't have to worry about it as much. Really, we want to make sure that we're washing toys, we're keeping the space clean, and that there isn't anything laying around at home that they could put into their mouths.
Yeah, so that makes a lot of sense. I mean, babies aren't the ones eating the allergens. It sounds more like they're getting exposed to the allergens through the people they're around. So that makes me wonder, if you do have a baby with food allergies, with known food allergies, is it best for you or other caregivers in the baby's life to completely avoid the food allergens and maybe even have a completely allergen-free home?
Yeah, I think that's a great question. I think the answer really depends on the family and it depends on other factors related to what the allergen is and how necessary it is for the family to keep it inside the home. So, for a lot of families, yeah, not having the allergen in the home at that age might make more sense because every surface is potentially a danger to this allergic child and they're exploring the world through their mouths. But on the other hand, some families might need to have that allergen in that house for some other reason. Maybe it's necessary to include in the diet of one of the adults or some other child, or it's something that they just want to have around. And if they feel confident about doing so, then they can keep it inside the house, but they should probably consider sectioning it off away from where the allergic child can reach it. So somewhere like the upper levels of a pantry would be reasonable.
Great, that's good advice. It's just about feeling out your comfort level, right? Because you don't want to accidentally expose your baby, but you also want to not have to completely shut things out of your life if you don't have to. So I think total balanced answer. I do have a funny question, and I think we're going back and forth, but this one I really would like to know about. I always say that I was born with food allergies. Is that statement right?
Technically, no. Babies aren't born with food allergies. Of course, they can develop them very early in life before their first birthday. So it's almost like, practically speaking, there's not that big of a difference, right? That's as far back as you can remember. But in general, we don't think that babies are born with food allergies. They can develop them typically after their first exposure to a food allergen. They can be exposed through breast milk, for instance, if a protein like peanut protein is in the mother's breast milk, or formula feeding sometimes, or early solids. So kids can be introduced to solids early in life around the age of 4 to 6 months. And that could be the timing of the first allergic reaction in the kid's life, almost as if they came out of the womb with the allergy. Just means that at some point during the course of those early stages of growth and development, their body became allergic to some food. Having said that, we know that IgE-mediated food allergies require prior sensitization. So the immune system, of course, needs to see an allergen and make antibodies against it, these IgE antibodies, these allergy antibodies against that allergen before a reaction can happen. So even though symptoms might appear the first time a parent offers peanut butter, for instance, or cow's milk to that young infant, the immune system has likely encountered that allergen somehow before, whether it's through skin contact or whether it's through breast milk, etc. The child's body needs to have formed IgE antibodies in order for that reaction to have developed.
One of the things that we've talked about in our previous episode is the skin barrier, because you mentioned how they might have encountered that food through the skin and how important it is for especially infants with eczema and a compromised skin barrier to keep that skin barrier intact. Can you also talk about early introduction? This is the time period, obviously, when we start introducing new foods. And we discussed this in our early introduction episode in depth. But once they are diagnosed with a food allergy, does early introduction look different in this age group? Because that's a question that I get often too.
So no, early introduction does not look different. We really want these babies to get all the exposure to the foods that they could possibly later develop an allergy to in order to hopefully head off and prevent the development of that allergy, or to prevent additional food allergies, even if we know that the kid has some food allergy at that stage of their life. We would continue to introduce the top 9 allergens the same way for these babies as for other babies. So early introduction was in fact studied in kids who are high risk for food allergy, either because they have a strong family history of it or because they have, like you said, other atopic disease, including atopic dermatitis. So it makes sense, therefore, that in this kid who is also high risk because they already have some food allergies, that we're still proceeding with the early introduction to the foods that they're not, at least we don't think that right now, they're allergic to at this stage of their life, in order to maximize the number of potentially allergenic foods that they can eat without developing an allergic reaction. We should also mention that in general, I'm speaking right now, we don't want to test a kid for a food allergy that they have not tried eating and for which they haven't had an allergic reaction, because of course that can result in a misdiagnosed allergy or a false positive allergy skin test. I know you've previously discussed this on your podcast. We can get false positives on allergy testing, both skin and blood testing, which means that a test can look positive when it's not really going to cause a clinical reaction in that patient, and the person's not really allergic. So when a baby comes in and they've had an allergic reaction, let's say to one food, we limit the testing to that food. And if that is positive, we don't go ahead and expand the testing to all of the other allergenic foods. We do have them continue to avoid that specific food to which they're allergic. We ask the parents to proceed with introducing allergenic foods just like any other baby.
Yeah, I think that this topic is something that we really, really need to stress, because I think that's the first thing that parents want. They want to, number one, confirm the allergy to that food that the child reacted to. But then the next thing they want to do is just do a full-on test to see every single food and make sure that that reaction never happens. And that totally makes sense, right? People don't want to have their baby ever experience a reaction again. They don't want to feel worried. But the key thing to remember here is that you're actually more prepared with your infant once you have a food allergy, in a sense, because we're going to give you an epinephrine device, right? So if another food allergy reaction were to happen, you have that epinephrine device to use, you know when to use it. it. And so in a sense, you're already ready, you're already prepared to treat that reaction. So that's also something that I emphasize with parents to help put them at ease when they're worried about introducing other allergens to their child. But again, in a person who already has a food allergy, it's even more important to do early introduction so that we don't develop further food allergies.
Since we're talking about reactions, is it possible for us to just give a really quick overview? Because we did a whole episode on infant anaphylaxis, so I don't want to get into the full details because that was a whole episode all by itself. But can we just talk really quickly about what an allergic reaction looks like and symptoms that parents should keep an eye out for if they are fearful that it is actually an allergic reaction?
Yeah, of course. Be on the lookout for any changes in the child's behavior. So if they suddenly become more cranky, if they're very clingy, if they're unusually fatigued after eating, unusually sleepy, that might even show up before hives or vomiting. Most parents will be aware of what their child's temperament is like on a day-to-day basis. If you see a sudden change in that right after eating, that might indicate the beginning of a food allergy, even before hives or vomiting start to develop. And then, of course, we can also sometimes see difficulty breathing, coughing as an early sign of difficulty breathing, wheezing, swelling of the face and the eyes. Those are some more obvious features that require immediate attention and immediate intervention for anaphylaxis.
Yeah, with babies, we're really just looking out for the signs, the physical signs, right? Because they can't communicate yet. But I'm thinking now, moving on, when babies are a little bit more communicative or toddlers are a little bit more communicative, does an allergic reaction look different after one? So from 1 to 5, does that look different?
Yeah, definitely. You're right. Babies who can't yet talk, they're unable to communicate what's happening in their bodies. Parents are going to feel more anxious and need to be alert to just the signs that they can see. But as the child gets more communicative, they can help us understand what's going on in their bodies. They may say, "Hey, I'm sick," or they may point to their stomach, indicating nausea, or they may just complain that they're feeling really tired. And then they may not have the language to specifically say everything that they're feeling, but they can indicate that something is wrong and something is abnormal.
You mentioned they don't have the same vocabulary, say, we do, but are there different ways that you have heard patients tell you is how their kid has communicated their allergy? Like, is there a baby talk for allergic symptoms?
Well, I wouldn't call it baby talk because they're, as my son would say, I'm not a baby anymore. He started to say that very, very early on. So as soon as they start talking, they don't want to be defined as a baby, but they'll say things like, this tastes spicy, or it's hot, or it feels like it's stuck. And so those kind of words can alert you that something might be itching in their throat, or that they might be getting some swelling at the back of the throat. Those are some terms that kids might use.
Great. Thank you, Dr. G. And I will make sure not to call a toddler a baby in front of their face. Pointing to someone who only knows teenagers right now. So, this is a fun episode for me to navigate with you guys. But basically, there are tons of symptoms that you guys have just mentioned. And like I said, I don't want to totally derail this episode and get deep into symptoms. So, I'll link to the different episodes you can listen to where you can get that deep dive and really see what symptoms are like and more of this whole understanding of allergic reaction in infant and toddlers. But what I would love to talk about is epinephrine. Let's talk about epinephrine in this age group.
Yes. Thanks for pointing those episodes out, Courtney, because I think that those episodes really are a good foundation for any new parent with an infant, especially with anaphylaxis, because we go through all the subtleties of what to look out for, when to know to use your epinephrine device. But in addition, I just want to make sure that we address this all the time, but it's important that your epinephrine device, beyond knowing when to use it, that it's always with your child. And I think that that takes a lot of getting used to for parents. I'll have parents that come into the office and they don't have their epinephrine device. And that's the one moment where they are thinking about their food allergy the most on days that they have their appointments with me, but they still may not have their epinephrine device. And so it's just getting into the habit of always having that epinephrine device with you. That's so important, and really the most important thing, because if you don't have your epinephrine, you can't use it. And then the next thing is actually a trainer that comes with epinephrine devices. So it's a fake epinephrine device, and essentially you can practice with it. So the caretakers can practice with it, grandparents can practice with it, aunts and uncles can practice with it. And that's a really important tool that we have have because practice makes perfect. And you don't want to be trying out this device for the first time when the child is actually having the reaction. So there's videos that you can watch, but then you can actually get hands-on practice, which is really important. So those are things that I really like to emphasize. But then it's also important to make sure that the trainer and the true epinephrine are separated, because we've also seen that sometimes people will use the trainer during an emergency instead of the actual epinephrine device that has the medication in it. And we definitely want to prevent that from happening, especially when the child is being taken care of by somebody else. There could be confusion. So you don't want to keep the training device in the same place as the actual epinephrine. And then as they get older, you can introduce the epinephrine device and practice using it on a teddy bear and making it less of a scary thing and just saying that this is our special thing that can help us if we're feeling sick. Just like Band-Aids are this really cool thing that kids love using. But again, I wouldn't leave the trainer around because I don't want kids to think of it as a toy, because then if they do see that real epinephrine, then they could get their hands on that and use it because they think it's a toy. So that's something important to remember also.
Thank you for bringing up that point really about separating your trainer from your actual device. Because you know what? I do feel like I've seen the epinephrine trainer in the toy box, and that can get really dangerous and really confusing, especially if you're in a moment of panic. You see it as a parent, you think, oh, good, there it is. Boom, you use it, but it's not working because it's the trainer. The other point I think you brought up, Dr. G, which was really good, is to train the people around your child. So just making sure that you train everyone who's going to take care of your child so that you feel confident. Like you said, Dr. G, practice makes perfect. Practice with those who are also going to share that time and take care of your child. And that is my segue into talking about daycares. What I would love to know is, what advice can you give parents when it comes to navigating daycares and explaining food allergies to that new setting for their baby?
There's several different things that you can ask. Really, the most important question relates to what to do in case an emergency situation does arise. So you really want to make sure that the staff has epinephrine and that they know how to store it and know how to use it. So ask the daycare staff, where is my kid's epinephrine going to be stored? If you are not providing the daycare with the snacks and the food for your kid, then you can ask them, can you see the snacks and read the labels with them and make sure that those snacks are allergy safe for this allergic child, and make sure that the staff is comfortable with and knows how to read labels to screen out the food allergies that are relevant to your kid in this particular case. But if there's one thing that you really need to ask, it's about making sure that epinephrine is available, making sure that the staff is trained in how to use it and knows how to store it appropriately.
One other thing I was thinking of, since we know that this is an age group that likes to just like touch everything and then put their hands in their mouth, is asking daycare staff about wiping down toys and different surfaces, just in case, like you mentioned, you're wanting to label read on what other kids are eating, but if they are somehow eating an allergen, if you still have allergens in the daycare, having that protocol in place that if kids are eating the allergen, at least you know what allergen it is. You've been allowed to read the labels, but also what happens if the allergen is eaten. How does the cleanup happen? Because you have to corral 16 to 30 little kiddos to wash all their hands and wipe down all the toys. So that's something else I was just thinking about when it comes to daycares.
Yeah, absolutely. It's really important that the staff understands that an accidental ingestion of an allergen can happen, and it can happen unintentionally due to exposure to a food from a surface or from something that another child or maybe a staff member ate, and it got onto a surface and then the allergic child then ingested it. That's certainly a possibility. And if the staff understands that, you can then get into making sure that that childcare center is able to wipe down surfaces, clean surfaces, and therefore able to keep the allergic child safe from having that accidental reaction.
And one other thing is that labels are there, but it doesn't necessarily mean that the product that you bought in June is going to be exactly the same as the product you bought in July. So it's also, as a parent, to be diligent about checking up on those snacks, because from my own personal experience, something that I thought was safe was not safe the next time I bought it or was going to buy it, because they changed the oil. And so you always have to continuously read labels. And that kind of needs to be something that you're also doing with the daycare, is to go in and check. And maybe you make sure that the daycare staff are doing it, but you also want to double check that whatever snacks they are, they might be the same, but it doesn't necessarily mean that the contents in the package are the same as when you first read that label. So I just want to put that out there as something that's happened to me multiple times, where a safe brand no longer became safe for me. we talk about as adults the importance of label reading, but how do you navigate labels with this age group?
Yeah. So again, we are going to take a deep dive into label reading because there's so many nuances to that we want to be able to communicate with people. But for now, it's just important to know that there's a label on every single food. That label tells you what the contents in that package are. And it's really important to make sure we're reading that. And as far as how to communicate that with toddlers, so they are sponges. And that's why it's such a beautiful age because literally they will start mimicking you. They're always learning and it's really, really special. And so we can start early with just showing them that every single time before they're eating, the caregiver, the parent, whoever, is always reading the label before they're giving them the food and just showing them that behavior and having that be a part of their routine together is a really good way of starting that whole process early on and making them familiar with it.
I love that. I think that's really cute to show your kid what you need to do eventually when you're an adult and you're on your own, right? So it's like instilling those habits now is really, really good. So Dr. Kawash also mentioned pet food. And that makes me think of like all of the other places labels show up that aren't something that we're actually ingesting. So I'm thinking of like a shampoo. You're washing your kid in the bathtub and you're using a shampoo and the kid's drinking the water because you're playing tea party in the bathtub or whatever. Or you have a pet who loves to give you face kisses. How do you navigate things that aren't food but can potentially have food allergens in them?
I think it's a great question because in this age group, anything, of course, that can be put in the mouth needs to be checked for the allergen. Anything inside the home that the kid might put in their mouth. And that includes pet food, which, as we know, can contain a lot of ingredients that a child might be allergic to. We're talking common allergens like milk, soy, wheat, fish, etc. They load up the pet food with it because it's good for the animal. It's high protein a lot of the time. But if a child's allergic to that, that can be problematic, especially if the child crawls all the way over to the bowl where that food is. So you really want to make sure that that doesn't happen if you have an allergic child and allergenic pet food. As far as the pet licking the child after eating the pet food that contains something that the child might be allergic to, probably at that stage it would just cause a rash in the area of the lick unless it somehow got into the kid's mouth. That's maybe not something that you want in general to happen. So hopefully the family can prevent that from occurring. But if it were to happen where it's just a lick of the skin, I think that would just cause a local rash.
Okay, so no French kissing with your dog. Noted.
Not even if it's a French bulldog.
Well, on that note, I'd love to pivot a little bit from French kissing our dogs to eating in a completely new environment. So I'm thinking about food that's prepared by someone else, and that someone else could be a grandparent, an aunt, or even a restaurant. How do we build the confidence and prepare ourselves to go into a new environment with our baby and let them eat?
Yeah, that's a really important thing that needs to be addressed. We need to make sure that we're communicating about the child's allergies at all time. The caregivers of that child need to be communicating about the child's allergies and doing that in front of the child so as to normalize the conversation, destigmatize it, help them build that into their routine as they get older. And hopefully that'll stick with them as a habit that they form for as long as they're allergic. You just want to communicate with, if it's a grandparent's house, make sure that the grandparents are informed. They will obviously be very sensitive to it because they're family members also. If it's a restaurant or restaurant staff, you can just lead off that conversation early on when you sit down to the restaurant. Just say, hey, we have some food allergies at the table that I want to notify you about. And increasingly today, I found that restaurants will often ask before taking your food orders, are there any allergies that you would like to tell us about? Which I think that's a good habit as well. That's something that also allows that subject to be addressed in a very informal way, but also it's a way that reinforces the fact that it is increasingly part of the routine in a society where food allergies are increasing. And you can also practice with role playing kinds of situations. So have the child practice with their stuffed animals, or you practice with the child's stuffed animals saying, I have allergies. These are my allergies. Can you please to make sure that the snack or the food that you bring out is safe for me to eat? Things like that can train the kid in how to handle those social situations, builds their confidence, and over time that builds up good habits.
Yeah, because at the end of the day, everyone loves to feed kids for some reason. And so you want to make sure that the child can speak up for themselves too. So there might be somebody at a party or whatever that just wants to give your child a treat. And so they need to learn early on to speak up for themselves. Obviously, if they're only one or two, that's not going to happen. But in those situations, you usually have more control. You can also use alerts like a necklace or a bracelet on your child to make sure that other people understand that they have a food allergy, especially if you're going to a social gathering. You can even put stickers on them that says, I'm allergic to this. Or some parents even get like t-shirts that they put on their kids when they're going out, like, I'm allergic to peanut. And that's their social t-shirt. So I think that, especially depending on the age group and where they're at, you want to try to keep them as safe as possible. And so these little things might help.
So, do you think that having a medical alert bracelet or warning on your child at any point is really good to have, party or no party?
It really depends. I mean, some kids really benefit from having a medical alert bracelet, especially if they have numerous life-threatening allergies. That can be really helpful. Not everyone needs one, but in some cases, yes, that might be something to look into. The medical alert bracelet doesn't need to be this very metallic, sterile looking thing like you see sometimes with adults or older adults, especially. They can be bright, they can be fun, they can be personalized to the child, and they can really help start conversations in a low pressure situation and help the child advocate for themselves and help people understand what their allergies are.
Yeah, those have come a long way since when I was a child. Now they're really cool. They're made in silicone. They have cool images of the different allergens that you can put on. You can swap them out. They're very cool. And they give kids more confidence, at least from my experience, of actually talking about their allergies because it's something that's concrete that can start the conversation. Like I said, so I was quite confident at that age. Before 5, I had no problems telling people about my food allergies. But how do you discuss this kind of like feeling towards having food allergies, both for parents and for kids? Because I know that mental health plays a lot in kid at 3 who feels different at birthday parties because they can't eat the cupcake that all the other kids get to eat, or the parent who all of a sudden has to navigate this bizarre new social situation they're in, having to ask everyone to accommodate their child. And maybe you're a person who doesn't like to ask for things, and now you have to do that for your child. So, how do we talk about mental health at this age group? Is this a big concern that you feel like you see with your patients?
Unfortunately, I think that mental health can play a part at any age group, especially as the child gets older and starts to understand that they might be different from other kids their age. And so, watching out for obsessive behaviors like frequently washing their hands, not wanting to eat when they're out, only eating with certain people, those kind of things can indicate that maybe something else is going on and that it's time to loop in a child therapist that can talk to them about their food allergy and help them feel more comfortable with the diagnosis. Because I think that as parents, we want to tell them about the importance and the severity of the situation, but sometimes kids can take that in the wrong context and they can get really, really scared and worried internally, and they don't really know how to express that yet. And so these other behaviors are a way for them to keep safe, but then it's turning into something much bigger. In addition, as you mentioned, parents can also start feeling very overwhelmed and scared themselves. And that fear can also translate into their child, because again, they're sponges, they're taking in everything that we do. And I don't fault parents for being worried and scared because it is a big diagnosis, but we need to manage that fear and anxiety so that it doesn't turn into an issue for the child.
Yeah, I honestly thought my parents had no fear or anxiety when it came to my food allergies until I hit my like late 20s, and they were like, "Oh my god, we were stressed all the time." And I was like, "What? You never told me that." And they're like, "It wasn't our place to tell you how stressed we were about your food allergies. It was our place to make you feel like you could have a full, exciting, adventurous childhood and stay safe." And so I think my parents were really good. In front of me, like you said earlier in the episode, is like kids mimic your behavior, right? So they mimic you reading the label, but they could also mimic you feeling stressed out about the food, feeling stressed out about eating. And I can see that going both ways. If a parent notices that they are starting to get a little bit anxious, a little bit stressed out, and they can't stop doing that in front of their child, what tip would you have for an anxious parent who doesn't need to see a therapist yet, but they're just trying to not show their anxiety or their stress in front of their kid? What tip would you give them to start feeling more confident with managing food allergies?
I think the most important thing to remember is that you already have the tools to keep your child safe. So you already have your skill in checking labels routinely. You know what should be done in terms of hand washing practices and what kind of rules should be enforced around the boundaries between the child and the exposure to their allergen. And you know how to manage things like epinephrine safely if the need arises. So I think just that reminder that, hey, there are a lot of people working on this. There's a lot of resources available in terms of where to turn when it comes to management of food allergies in a child. And that should relieve some of the parents' anxiety. Just go back to your predictable routine. You know what works, and just remind yourself that this is something that many families are going through and the tools are available.
That's awesome. I love that. Set your foundation, trust in it, and you're going to be okay. I feel like this has been a really interesting episode for me. I learned how much I don't know about 5-year-olds. And I would love to know from you guys, what is your number one tip you would give a parent who has a 0 to 5-year-old and they've just joined us on this food allergy journey?
My tip to the parent of a 5-year-old is that them having food allergies does not mean that they have to be socially isolated. We live in an increasingly allergy friendly and especially food allergy friendly world when it comes to kids. So, with safe planning, making sure that safe snacks are available, making sure that the epinephrine is available and on hand, if needed, kids can fully participate. And I will also add to that that there are a lot of allergy friendly recipes available whereby kids with food allergies don't need to be excluded. So not every kid can eat birthday cakes for a variety of reasons, but they may be able to enjoy some other birthday muffin that does not include what they're allergic to, or there may be even an allergy-friendly birthday cake if it's that particular kid's birthday on that day. So food allergy life does not mean social isolation is the tip that I would include here.
My tip would be you are prepared, you are ready should a reaction happen. Epinephrine works, so don't worry. And I know that's easier said than done, but we just want to make sure that you understand when epinephrine is used, your child's reaction will subside and it will be okay. And so if there is an accidental exposure, even though you're trying your best to avoid it and to prevent it from happening, they do happen. And that's okay because we have epinephrine. And as long as we always carry it, we understand how to use it, everything's going to be okay. And those are 2 things that you can prepare for. And so I think just knowing that you have the tools and that you are prepared should an accidental exposure happen, I think is my number 1 tip for new parents with food allergy.
Amazing. Thank you guys so much. Remember, you've got this, parents. Both our doctors have said the tools are there, and it's about integrating it into your life in the way that you feel confident about and that you can share with other people so that they also feel confident in helping take care of your child.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.